The condition can be treated with the local and distal point that are paid in some way and indicated clinically for the condition to be treated. So we can treat with the very small number of the points while selecting the local point for the affected area. The Hashi, that is the pain trigger point, and back shoe point should be included, and most of the powerful adjacent meridian should also be included here. The local points are generally used to reduce the inflammation and it ease the pain and to improve the circulation of the chi and then blood in the specific particular area. For instance, in the case of the low back pain, we use the Huato points to treat the inflammation and pain near the herniation. We may also choose the local points by the area as described above or by the clinical usage of the point. In the example of the low back pain, this would include the points such as Shen Shou UB23, which is useful locally, and then it is the back shoe point of the kidney is helpful for all the chronic related to the back muscles pain. So now local refers to the vicinity of the pain, those the pain of the head, neck, forearm, low abdomen, knee, foot, etc. can be treated via the points in the respective localities. Right? We look at about the knee pain can be treated by using the local points like gallbladder 34, spleen 9, spleen 10, stomach 34, scion, stomach 35, with the other side of the patella. So GB34 is the influential point of the tendons, and pain of the wrist is needed at the Sanjio 5 and then large intestine 5 and 6. So now you look at, since we have completed certain meridians and points, of course now we are using by what we studied how we can able to treat by using the certain local points to treat for the local diseases. So that itself, it having the micro circulation and it reduce the inflammation if you are using that particular area where do have the infection or the inflammation, right? So now for instance, we look at the pain related to the knee. So knee pain in generally, there are the all the knee pains are not the same reason, you understand in the beginning, right? So because of knee pains are numerous reasons to cause the pain, but however, since the points which is located situated at the knee level, then you understand those points, it works to the local area, and also that works to the meridian pathways to open, at the same time that works for the internal organs, at the same time that works for the coupled organ as well. So this is the majorly the physiology of the each and every acupuncture point. So now when we look at about the points called as a Yang Ling Chuan, so that point to be called as a GB34, so which is existing on the inferior border of the fibula and the head of the fibula. So this point in fact is good point to treat for the lateral side of the knee pain, since the point is located on the lateral side of the patella. Because of we wanted to know if we look at about the deep level, so this GB34 in generally is equal to Chiangu, that point is the stomach 43. So stomach 43 is the tonification point and GB34 is the grandson point, that means is the sedative point of the gallbladder meridian. So now when incorporated, when you apply this GB34 is located on the knee region, so that particularly used to treat for the gallbladder is treatable for all the sinews and hard tissues in our body, whereas in stomach 43 is elevating the soft muscles in our body. You remember that when the soft muscles are strengthened, then all your tendons will become strengthened. Your tendons become strengthened, then it will become the more support to the cartilage. If the cartilage is enough good amount is there, so then you understand your the tendon, cartilage, and then ligaments also will become strong. When the ligaments get strong, then ligaments are attaching to the directly to the bone. There is the articulating to the bone also really good. If there is in between, there is a problems between the joints or between the muscle to tendon, tendon to the cartilage, to the ligaments, ligament and bones, all are connected each other. If this both our muscles are supporting, then tendons get strengthened, then tendons get strengthened, the ligaments also get strengthened. So in this way, due to this reason, this both are combining together, because of once you activate this point, there are the numerous clinical manifestations can be treatable by activating this point. So that, for instance, the people who are suffering for the fatigueness, and then the people who have the nausea and bitterness in the mouth and excessive pitta is existing, even that condition also, acidity and gastric and stomach related diseases also causes the knee pain and arthritis, etc. In this perspective, when you add up this point, and certainly this is treating for the all the muscular system motor impairment conditions, or the muscular atrophy conditions, even the hemiplegia conditions, multiple sclerosis conditions also can be treatable by activating this point. At the same time is the cholelithiasis, where the gallbladder stones also existing, that also can be treatable by activating this point. However, there is another point to be added up to the cholelithiasis. That point is called as a Tannang, D-A-N-N-A-N-Chi. So that point is close to 1 to 1.5 chun distal to this GB34. That area is Tannang point, that indicates all. There is the alarm point for the gallbladder. You wanted to know there is the gallbladder stone is causing the pain, or acidity or gastric is getting the pain. Then you understand, if there is the point is Tannang point is getting the very tenderness point, then that indicates there is a gallbladder stones are existing, right? So in this way, we need to focus and treat to that particular point as well, along with the Yang Ling Chuan, right? So when we look at in the deeper level, inside of that, there is the arteries called as a genicular artery and then genicular nerve. So this is the branches are circulating to the knee. At the same time, when we look at about the various nerves, especially the nerve called as the peroneal, common peroneal nerve, divided into or bifurcates in the two nerves. Those nerves called as a superficial peroneal nerve, the other nerve called as a deep peroneal nerve will be divided in at the place of the closer to the Yang Ling Chuan GB34 area. So therefore, the lower extremities of the anything related to the muscles are related to the nerves, or the lateral side of the dorsal side of the leg, that is the dorsal region of the foot, and then lateral side of the area where we call as a peroneus longus and peroneus brevis muscles, that lateral malleolus area, and then the metatarsal bones area, all are related to this both the nerves. Of course, at the same time, this indirectly supports to the tibial nerve as well. So therefore, this particular point is good enough to treat for the various conditions. But why I wanted to tell you this, because you people completed some of the points, but you wanted to know what is the major physiology. If you use the local points, you understand this point is useful to that particular condition. When we look at about the spleen 9, that is in Ling Chuan, that is spleen 10 is the Su Hai. So where those points are located exactly, when we look at about the various points here, like spleen 9 and then spleen 10, the point is located on the medial side of the sartorius muscles. When sartorius is the longest muscles in our body, when that muscles get weakness, then you understand it is related to the where the quadriceps muscles, where the iliotibial band, so where the tensor fascia lata, the origin, from there it ascends in the round direction, that indicates there is a pain in that particular condition. Maybe there is a problem in the hip muscles, the anterior hip muscles, or the AC is called as anterior superior iliac spine. If that gets a weakness, then you understand that also causes the pain of the knee. So therefore, spleen 10 point Su Hai, the name indicates Su means is the blood, Hai means it is the meeting point or the communicating point or the nexary point of that particular region where there is the junction of the blood called as a Su Hai. So therefore, once you activate that point, that is strengthened to the blood in the patella region, that's supposed to the various vicinity of that arteries where the anterior cruciate ligament ascends in the upward direction, that support to that also. At the same time, the artery which we call as the genicular artery, that also will support to blood flow. And these points are really good. Sometimes sometimes that called as a there is a pain causes of the knee pain, sometimes it's called as a G block. G block denotes here is the genicular nerve block. There are the three areas the genicular nerve gets blocked for the knee pain. Generally it is related to the very closer to the C yang Kuan, so that point called as a GB33 area, and then the another area called as a, the medial end of the patella, so that is very distal to the Suhai, that is spleen 10. The another block causes the pain related to the area called as a in Ling Chuan, spleen 9. So these areas, spleen 9 is the very sensitive area for all the females, already I told you. So that place sometimes it causes the blockage of the genicular nerve block, it causes sometimes is the pain. Even that condition also, without activating very deeper level, but just you apply the 1 chun to 1.5 chun, or if there is the clumsy or the obese patients, you just try to apply very deeper level, that means even can go closer to the 2 chun, but you should not touch to the nerve. So that now already it got compression, sometimes it leads to the pain. So therefore these are the local points. If there is a nerve blockage also can be treatable by activating spleen 9 and then spleen 10 points as well. Right. So when we look at about the Liang Chu point, that point to be called as a stomach 34, that also is the C cleft point of the stomach meridian, so which where we have already completed this. So that point also is the local point for the knee, having the local effect. Right. When you wanted to treat the lateral muscles of the where we call as a IT band, where we call as a motor point of the muscles of the tensor fascia lata, or there is a IT band is getting the compression, or there is a kind of the rigidity of that muscles, so that also leads to the problem of the knee pain. So even that peroneal nerve get compression, that time also we can use, there is a point is called as a Liang Chu point, is always is good. So the other point which we call as a for the whole knee, there is there is 2 eyes, how the face have the 2 eyes, in the similar way there is the eye for the knee called as a patella, having the one eye is the medial side, the other eye is called as a lateral eye. Right. The ligamentum patella, there are the 2 eyes. So both the eyes you wanted to treat the patient, the person is suffering for the knee osteoarthritis. In this condition certainly this will get compression of the patella, which we call as a patellofemoral syndrome. So that condition we wanted to treat bilaterally, both the conditions. You just use the points is the one eye and just apply the another eye of the patella is opposite each other and communicating the 2 needles each other on the knee region. So this will be certainly helpful to the patient where the patellofemoral syndrome is existing. So even that condition, at the same time there is the anterior cruciate ligament or the posterior cruciate ligament, that condition also can be treatable by activating the 2 points. That point to be called as a C yan point is the medial eye of the patella, and then 2P, so that point to be called as a stomach 35. So incorporatedly you are activating the points that to be treating for the local points, having the local effect in order to flow the chi and then blood if there is a retention is existing within that, and certainly at the same time you are activating to the gallbladder, you are activating to the stomach and the spleen, and whatever meridian you are activating, then you understand you are activating to that particular points. So now let me see, there is another point which we call as a Wei Chung, is called as stomach 40. So stomach 40, the vicinity area of the popliteal fossa, which already I told you there is a diamond shaped hollow which is existing on the posterior side of the knee. So that particular region there is kind of the retention of the saphenous nerve, retention of the popliteal nerve, and then retention of the various branches of the nerves, sciatica nerve. So that time slowly it leads the problem of the knee pain. Even you use the point called as a Wei Yang, Wei Chung, and then Lucy. So these are the points which we call as a UB39 and then UB40, UB38. All these points are really good to treat for the various nerves which is communicating to that particular region. Now sometimes you are not aware of the nervous system, you are not aware of the arterial system, then you need not to worry about that. But however, the acupuncture, traditional Chinese medicine acupuncture and then Western medical acupuncture, so however you wanted to treat by using this, and that will work scientifically, at the same time that will work traditionally as well. So therefore, once you activate, so then you are activating the popliteal artery, then you are activating to the UB40, you are activating to the saphenous vein and sciatica nerve also. So therefore, you understand, so you just your duty to activate that particular point having the particular effect. So now you need not to remember everything, but however, as a acupuncturist, and certainly you can use if the person is suffering for the knee pain, by using the local points are not harmful. Most of the acupuncture points which is existing on the knee region also called as the Ha-Si points. So that means is the conjunctory points, also known as a command points, which having the ability to transfer the energy or interchange the energy from the one organ to another organ. So therefore, when you apply the UB40, so that governing to the urinary bladder also, and also that governing to the stomach as well, right? So at the same time, when you are treating to the GB34, that means you are treating to the stomach and gallbladder together. When you are treating the stomach 36, then you are treating to the stomach itself, because of all the muscles and most of the muscles. How many muscles are existing in our body? 642 muscles are existing in our body, which includes the macro and then micro muscles. Major muscles are the minor muscles, right? All these muscles are regulated most of the times by stomach. When the stomach, which is the most important organ in the traditional Chinese medicine, called as a spleen. Spleen is the mother for all the organs, but don't ask me, then I told you the heart is the monarch for all the other organs. But of course, if we look at the each and every organ, the perspective that having the major significant role about the each and every organ, in fact, is very crucial. They have the lot of numerous and thousands of functions which is existing by using one organ. So therefore, so spleen also most important. The coupled organ is called as the stomach. When the stomach is enough quality of the vigorous energy is there, therefore that taking that energy itself is strengthening to the spleen. If the stomach is deficiency, then you understand all the spleens get deficiency. You understand the spleen is the major role. The each and every organ where is existing. The heart is existing in the chest cavity. The lungs is existing in the chest. At the same time, liver and gallbladder and stomach and spleen is existing in the peritoneal cavity, abdominal organs. When there is the lower portion is pelvic cavity is existing, all the small intestine and pelvic organs. So all the internal organs are placing on their precise locations. So which organ is supporting? Then you understand that organ to be known as a spleen, that pancreas. At the same time, the spleen is majorly functioning for the lymphatic system as well. When the lymphatic system or the drainage system doesn't work in our body, that get the retention, that leads to the various abnormalities in our body, which get displacement of our internal organs, displacement of our vertebrae, displacement of our muscles or the internal organs. For example, uterine prolapse, vaginal prolapse, abdominal prolapse, the pelvic prolapse, etc. So all these things are placing on their respective place. That spleen is crucial. So